Hello again. So this video, my name is Dr. Erica Steele, and this video is about physical health. And so people often come into my practice because of a physical ailment, meaning that either they have a diagnosis, either they're concerned about their nutrition, they're concerned about health risk, they're concerned about preventing disease or preventing genetic issues that they've had or their families have had, or they've been to every single doctor underneath the sun and they still haven't gotten the answer. A lot of times those people are burnt out. They often say, I hate doctors. And I really can't blame them for having that feeling. They have been kind of passed around and given various different medications, and maybe some have worked and maybe some haven't worked, and some have had side effects, etc., that have created various different other issues that they're dealing with. So people come into my practice for a variety of reasons, and most of the time it's a physical ailment that is driving them to come into the practice. When we're addressing the health on a physical level, we look at a combination of things. So I look at symptoms, right? Even though I'm not treating symptoms, that's not my job. Allopathic doctors treat symptoms. Symptoms are really clues that the body is telling us about where the balances are. So as a naturopath, I need those clues to be able to determine kind of what the body is telling us. Then we'll also look at diagnoses. Now, a diagnosis is nothing more than an educated guess. It's a collection of symptoms. And so diagnosis can be wrong. Diagnosis can also be right. But people come into the office with various different diagnoses. And some, again, may be right and some may be wrong. And so we don't spend our time focused on the diagnosis, and we don't treat diagnosis. We also don't diagnose. That's what an allopathic does. Allopathic doctor, like a medical doctor or an osteopathic doctor, they're trained to look for and assess and then diagnose a disease. And diagnosis is nothing really more than a sophisticated labeling system. It's a way to label the body. And then once there's a label, then there's a method of treatment that's been provided. So in allopathic medicine, there is usually either pharmaceuticals, active surveillance, procedures or surgery available to be able to treat that disease. In allopathic medicine, you tend to be just the diagnosis and you're no longer the person. So they're trained not to necessarily look at you as a person, but trained to look for and identify the disease, and then they're treating the disease. And so that there's a very systematic approach to treating disease and treating diagnosis. So this hypertensive case and that hypertensive case tends to have similar treatment protocol because that's what's been established by the FDA and by the AMA, etc. In naturopathy, it's a very different approach because we're actually treating the person. So we work with the person on a physical level, and we're looking at the physical nutrient deficiencies within the body. So we're looking at nutrition, we're looking at what the person is eating or what they haven't been eating. And then we also look at how they're digesting and assimilating that nutrition. And we want to make sure that we repair that, because we do follow Hippocrates that all diseases begin in the gut. Hippocrates is the father of Western medicine. A lot of times people think that naturopaths are not Western doctors. However, we are. We do use some Eastern philosophies in our practice, but we are rooted in Western anatomy, physiology, biochemistry, etc. So we're going to look at the nutrition of the body. We then look at how the body's expressing those symptoms, which we believe is rooted in either nutrient deficiencies or accumulated toxicities. So we believe that disease comes as a response of accumulations of toxins within the system, and then those toxins then create disease process. And so we're looking for what those toxicities may be, whether that's bacterial, viral, chemical, heavy metal, parasitic, fungal, yeast, that sort of thing. We want to look for all of those various components, and we want to eliminate those out of the body. So there's a lot of nuance to it. And in my practice, it's always a balancing act. We want to build the body, and then we want to help take things away. So build, take away, build, take away, build, take away. And that takes some time, and it is a process that it does take a little bit of patience on the patient's part, especially because by the time I get them, they've had a lifetime of unhealthy habits, or maybe they've had some healthy habits, some unhealthy habits, but they haven't been specific and balanced onto them. Just because a person is a vegan doesn't make them healthy. Because a person is skinny doesn't mean that their bodies are balanced. And so we get culturally into these ideas that just because one variable is like this, then that means all the other variables are balanced. And that's not necessarily true. So when we're looking at the physical aspect of the person, we do evaluate biochemistry. I use a lot of whole blood. There are a lot of different other physical diagnostic tools that are used in naturopathy. There's iridology, where people read the eyes. I'm not trained in that. There are live blood analysis, which is just like a finger prick, and then they evaluate the live blood there. I'm not trained in that currently. I'm trained more in functional medicine and integrative medicine. And so I'm going to look at the whole blood. I'm going to look at stool, serum, urine, various different specimens from the body, and then we evaluate it through laboratory testing. So we have basic laboratory, which is your typical standard blood panel that you would get at your physical, your CMP 14, which is your comprehensive metabolic panel, which is your kidney and liver function, your CBC with differential, which is your expanded immune system, a TSH, which is the communication between your pituitary and your thyroid, and then your lipid panel, which shows me actually how your liver is processing fats. And so that can be very helpful in looking at metabolic rate, et cetera. So we look at that kind of basic panel initially, and that serves as a guide. Now, some naturopaths or functional doctors, they will run lots of testing at first. I am not one of those doctors. I believe in you want to have a treatment with every test that you run. And so I'll run a test, evaluate that, and then treat based off of that particular test. And then, work on that for a little bit. And then I'll do the next step and the next step and the next step. So I tend to work in a very step-by-step process in a physical aspect, because the body gives us information in these laboratories. And so there is a hard science to reading labs, but there's also an art to reading labs too. And that's why I'm heavily trained in reading the laboratory in the manner that I am, because I love the art of the practice and understanding all the various nuances to it. In laboratory, you can see a lot, not just the physical aspect. You can see a lot of lifestyle component. You can see emotional things if you know what you're looking for. You can see just all kinds of information that's just really fascinating. So I love using that tool to be able to understand various different things. Physically, when we're treating, we do use GMP certified supplements. Those are pharmaceutical grade supplements. We use those because those are going to move biochemical markers in different directions. If we use more retail, more lower cost supplements, there's no guarantee that they have enough juice or enough energy to be able to move the lab numbers like we need them to move. So there's that. We also look at various different homeopaths, which is low frequency medicine. We look to help support the body's ability to heal. I use this a lot when treating more emotional imbalances. And then there's a lot of detoxification practices, herbs we use for that, as well as various different services that we have in our practice. So from a physical perspective, those are a lot of the various modalities that we do. We'll use steam, we'll use infrared dry sauna, we'll use biomat, we'll use all kinds of different modalities to be able to help the physical body as we're going along. However, we're not just physical beings. We have a lot of other different things going on. And so hopefully this helped you to understand a little bit more of the physical aspect. But then, as we kind of look into other videos, I'll talk about some of the other areas of the human that we treat, which is more of the mental, emotional, environmental, etc. So thank you.